Introducing One Trafford Response, a new approach to help Trafford citizens support themselves and live as well as they can. The idea behind what we want to do is quite simple. We can look at our population of citizens in Trafford as a pyramid. Those at the top of our pyramid are in our hospitals, mental health services or intensive social care support. They are complex enough to require specialist support. Those in the next tier are known but are not complex enough to be in the top, but are struggling and at risk. They find it difficult to access the support available. The people in the bottom tier are well. They are able to self-manage any conditions or needs and know where they need to go for support. We need to reduce our costs, responding and working locally and close to the patient, helping them move down the pyramid to happier lives with lower demands on the system. To implement this new approach, we're going through a three-staged process. During step 1, we ran projects to generate ideas and our core principles, working out how we would be able to implement the place-based model and work together. We are now in step 2, live with the multi-agency community-based approach in Stretford, making a difference to the community and enabling people to make changes for themselves. Step 3 for us will be to roll out the approach into our neighbourhoods within Trafford, growing the model and delivering more joined up working at a community level, helping improve the experience for our citizens.
We ran 2 project weekends, the typical weekend followed by the One Trafford Response weekend.
The aim was to improve the customer's experience when accessing services, understand the costs and benefits of how we work together, and use the learning to shape our future plans. A multi-agency hub was tested and agencies came together, discussing issues that arose as they happened, hearing how each of us would respond, and agreeing new ways of working. Sat alongside them was a multi-agency intervention team with a range of skills and experience who went out to deliver creative, lifetime solutions to the cases presented. There was a huge amount of learning from the weekend, which helped us to understand and listen to our citizens in a different way. We found local solutions in the community and brought the services to the citizen at the right time and place. As part of a multi-agency team, we understood our roles and responsibilities better and shared learning and practice. From these projects, we identified our key principles. These principles guide us in everything we do. Doing what matters, focusing on the aspirations and personal outcomes of those we work with and the essential activities to achieve these. Measuring what we've done, evidencing that we are making a difference through hard and soft evaluation. Testing, learning and adapting, improving the effectiveness of the work we do and overcoming obstacles. And most importantly, recognising and pulling in everyone's strengths, maximising the collective assets of citizens, employees and the community. Our response to these key principles is the One Trafford Response, our aim to join the Trafford jigsaw for our citizens, working with them to support themselves and live well. In April 2017, we launched our new One Trafford Response service and started to take cases in May, operating in a small area of Stretford, trialling new ways of working. Co-location of around 20 staff from across partners, which includes Council, Trafford Housing Trust, Police and Fire Services and health providers, all supported by lifetime information sharing. Unlocking the potential of frontline staff, blurring of the professional boundaries, maximising the key worker and case coordination approach, connecting place and community assets. John's story helps to explain what we do. He was known to services but did not reply to letters, suffering from ill health and frequently in hospital but missing appointments. With previous contact with the police, time in prison and a drug addiction, unable to read and write with bills piling up and living in a property without the basic essentials. John looked for people to help him, but no one really understood his problems or the different interactions he was having with lots of different professionals. The hospitals he visited looked at his health but were not equipped to tackle his broader issues. His GP did a great job, but John still felt no one really understood. John was given too much information and was unable to understand. John ended up visiting 4 hospitals in one day, trying to find someone that would listen to him and help. After 4 visits to hospital, John had had enough. He started to walk out in front of traffic and the police were called. Something had to be done. John needed help. We stepped in. We assigned Amy, a key support worker who coordinated, assisted and empowered John.
An engineer fixed John's heating. Trafford Assist replaced his damaged cooker, sourced clothes from charities, provided food bank vouchers and got John some paint for his house. John was encouraged to attend and speak with his GP for help with his anxiety. He is now reunited with his son. John is now taking himself out to the food bank. All of this achieved in just 27 days.
We had come together as a team of professionals with a common understanding of John's needs. Finally, John felt like his voice had been heard.
From my perspective, I felt part of a multi-agency team, bringing different perspectives, learning about more options for community support and removing duplication.
Back to our idea and the model, we can see John's journey. John was in and out of our high-cost services, unhappy and impacting the health and social system. One Trafford Response intervened, providing some pragmatic solutions. John is now well on his way to being self-managed and his impact to the overall system has decreased. It's still early days for us, but we've got many more examples just like John. To find out more about the service and the difference we are making, please contact Jenny Hunt.